A neurologist is a consultant specialist or physician that focuses on diseases of the nervous system. The nervous system is a broad spectrum of body functions ranging from the brain, the spinal cord, the peripheral nerves in our limbs, and the muscles. A neurologist may be asked to consult people with a range of different symptoms. Common reasons that people need to see a neurologist include headache, disturbances of sensation like numbness or tingling, weakness in the limbs, difficulty walking, problems with balance, dizziness, tremor, and sometimes a loss of consciousness. When you see a neurologist, there's a great deal of focus on listening to the description of your symptoms. And in our training as neurologists, we're often taught that if you listen carefully enough to your patients, that they will tell you what's wrong. What I focus on is collecting information about the person's symptoms, their past medical history, and medications, because these can be very relevant to neurological problems. I'm interested in people's family life and occupation, because these, of course, can be affected by neurological disease, and whether there's anyone in the family with similar problems. The next step in the consultation is the neurological examination, and finally, I'll conclude by reviewing any investigations that have been done and discussing my findings and suggest a plan for further investigations and treatment. Neurologists are often very interested in the symptoms, how they've come on, how they've progressed over time, whether there's any associated symptoms affecting other parts of the body. And so I think it can be helpful before seeing a neurologist to gather your thoughts about your symptoms, maybe make a few notes to bring along to the appointment so that nothing is missed. The neurological examination involves a check of strength, the tone of muscles, the reflexes, sensation, and walking are some of the key elements. And this is quite detailed and can take some time if done correctly. For many neurological conditions, like migraine or Parkinson's disease, for example, there may not be a need to do any diagnostic testing. In other situations, the sorts of tests that may be needed to reach a firm diagnosis include an MRI scan of the brain or the spinal cord, sometimes neurophysiology testing to look at the function of the brain or measure brain waves using the EEG, or sometimes tests of the nerves and muscles themselves using nerve conduction studies and EMG. Occasionally, it's necessary to do a lumbar puncture to take a sample of the spinal fluid for analysis at the laboratory, particularly if we're suspecting inflammation in the nervous system.